What are the different types of counselling or psychotherapy, and does it matter? There are many different types of counselling and psychotherapy. Examples of types available in the UK include, but are not limited to, psychodynamic therapy or psychoanalytic therapy, for example, psychoanalysis, humanistic-based therapies, for example, person-centred therapy, arts-based therapies, for example, drama therapy, cognitive and behavioural therapies, for example, CBT. There are differences between these different types of therapy. Psychoanalysis works with unconscious feelings, thoughts and conflicts. You may be invited to lay on a couch and encouraged to say whatever comes into your mind without censoring anything. The therapist will interpret what you are saying and is there to help you discover hidden patterns and meanings. You may gain insight into your behaviours and problems that you're experiencing. Psychoanalysis provides a space for focusing on past traumas and events that may have been forgotten about, linking these to what you are presently experiencing. For example, by connecting past and present, this can help you make sense of what is having a negative impact on your relationships in the present and can inform relationships for the future. All of this takes time and could last from around 1 year up to 7 or even more. Person-centred therapists aim to create an environment where you experience them as warm, empathically understanding and genuine. Rather than giving you advice, the counsellor considers you as the expert in your life and you choose the direction that therapy takes. This may feel strange at first, especially for those who expect their therapist to guide them and provide answers. But having the therapist be alongside you and responding on an equal level rather than adopting the role of expert may enable you to find the answers within yourself and build on this. Person-centred therapists aim to maintain a non-judgmental stance to whatever you bring to the sessions. As you experience person-centred therapy and the conditions laid out, you may feel better able to understand and connect with your own feelings and inner values. Your sense of self-worth may increase, and as you explore your feelings, beliefs, worldview, and whatever is troubling you, you may become more self-aware and identify strengths and resources within yourself and in your life that you can use beyond therapy. As a person-centred therapist myself, I have witnessed clients grow during therapy and go on to experience fulfilling moments in their lives. Drama therapists facilitate a space where you can explore emotions through the medium of drama. They will encourage you to explore what you are hoping to achieve and evaluate your needs. You may use equipment, materials and props such as puppets and masks, and sessions can involve improvisation, story, roleplay, mime, movement, acting out situations from the past, and script work. Feelings may be experienced that you may not usually allow yourself to feel. This experience can be cathartic, cleansing, releasing, and increase your self-esteem, confidence, and help you to develop communication skills. Cognitive behavioural therapists help you to identify negative thought patterns and behaviour by exploring your thoughts, feelings and behaviours by working through exercises. You may focus on what is happening in the present day or focus on past experiences and the effects of them on you. Therapists may encourage you to complete activities at home, such as completing worksheets and keeping a diary. This work may continue after the therapy sessions have ended. The therapist takes an active role in showing you ways in which you can deal with or manage problems by teaching you coping skills. CBT aims to retrain or rewire your brain so that it feels less overwhelmed. As problems are broken down into smaller parts, they become more easier to manage. Through CBT, changes in the way you think may result in a positive effect on the way you feel and behave. So, there are differences between the different forms of counselling and psychotherapy, and what works for some people may not work for others. This could be due to various reasons, but it may be that you naturally respond better to one form of therapy over another. Therefore, it may matter what type of therapy you access.